Transformational Leadership in Nursing. Thank you for this great opportunity. I would like to go for the acknowledgement, which I need to do the last, but now itself, because I need to thank my management for giving this, especially to render a very effective topic, which is a need of the hour. So let me go to the topic: transformational leadership in nursing. So let me go on to the introduction. I think we all know very well transformational leadership. It's transforming. We need to transform ourselves. So that is called as transformational leadership. Nothing new, but we are going to transform completely in all dimensions. So when we talk about this, it's going to be a supportive, empowering healthcare environment, and it is also very important life leadership style because that is helping to motivate the team mainly to work together, especially to deliver exceptional and extraordinary patient care and outcomes. So this is going to be useful in all the organization setup, especially in the industry, healthcare industry, as well as even in the educational industry too. So when we talk about the healthcare, we know as healthcare evolves, the transformation leaders in the healthcare, that is the nursing, are very indispensable because they are able to go with the resilience, they are able to go with the inclusivity, sense, and also they are able to tackle lot of new challenges that is coming ahead. So when we talk about that, I think we all know very well there are many transformational leaders. So like we have our honorable Mahatma Gandhi ji, and also when we talk about the service side in nursing, especially when we talk the person who was caring, who was nurturing Mother Teresa, she is a transformational nurse. So when we talk about the transformational leaders, so there are many leaders like John Kennedy, Roosevelt. So they all come under Nelson Mandela. So they are coming under the transformation leaders. So these people are having a, because we know when we talk about the transformation leaders, they do need to have a charisma. So charismatic leaders, or sometimes we call them as a servant leadership style. So we know very well Mahatma Gandhi. So he is a transformational leader, and also Mother Teresa. So the transformational leaders. So when we know about the transformation leaders, who are transformation leaders? What's the difference between other leadership and transformation leadership? Because we know very well transformation leaders, they don't start because they are going with the intrinsic motivation, and also they are very importantly when we see they are not going to deny. So they are not going to deny the world around them. They just try to accept everything, and also they are very much because they are able to describe the future. They are because they are very much interested to create the future, and they are very much interested to accept the future, and they are interested to mainly accept any challenges that comes into. So when we talk about the tradition, I think traditionally when we talk about this nurses, they are very much like we know they are overmanaged, and also they are not able to lead properly. They are mostly they are leading inadequately, but they are facing lot of challenges and opportunities. So organizations mostly they face lot of challenges, and they face many changes, and because of this they require an adaptive style, because when we need very well, so there should be a style that is very important. They need to adapt to a very important style, and they need to go with a flexible leadership style. So when we talk about this, we need to know about a brief history, because there is one person named Burns. So this person in 1985, yeah, like sorry, in this Burns actually, I think when we talk about this kind of leadership style, we know it has started with Downton, that is James Downton, who was a sociologist in 1973 itself. He has written a book. In this book, he has written about the charismatic leadership, and slowly this particular idea was developed in the minds of a historian, James McGregor Burns. In 1978, he has written a book on leadership. So in this, he has completely wrote about the transformational leadership. And then it has again when the Burns was describing about the leadership, he told the transformation leadership is nothing but when two or more persons when they are engaging with others in such a way that the leader and the followers they are going to rise each other. So that it means they are going to help each other to come to a higher level of motivation and morality. In 1985, there was another person, scholar Bernard Bass. So he has developed a four elements of transformation leadership. That is the four pillars, so which we'll be seeing it later on. So when we talk about transformation leadership, it is a management style or it is a management theory which is going to motivate the employees or the motivate the followers mainly to take a ownership roles, and also it is helping them to perform beyond the expectations. So whatever they are expected more than that they can perform, they can go with out of box thinking. So we all know very well nowadays even out of box thinking also has gone, and people need to think as though they don't have a box. So like that this kind of leadership style is very important, which is helping the people to become more and more creative and go with the decision making and also a problem solving technique. So here, when we talk about the transformation leadership, it is teaching the people how to think, because they are not telling them, they are just not giving the instruction and asking them to follow. They are thinking and they are doing it as per that. So when we talk about the definition, we know very well it is a management approach or management theory where the leaders inspire, encourage, guide, and motivate the employees, and especially to align to their own objectives with the success of the firm or the organization. So individuals of this leadership track mainly learn to manage different situations in an organization, especially to boost the productivity by increasing the self efficiency in team members. That is very important. So when we talk about the leadership style, that is, it is a leadership style which is inspiring the employees mainly to strive beyond the expectation, and also to work with a shared vision. They are going to have their own objectives and they are going to share. They have a visionary. So it is mainly helping to learn the balance of these styles and help the leaders mainly to go with the fullest potential. So when we talk about the transformational leaders, who are the transformational leaders? Same. They are inspiring, they're motivating the employees mainly to better find a better ways of achieving the goal. And they are mobilizing the people mainly into groups so that the work can be done. So here they are going to rise the well-being, morale, and motivation of the group, especially with their very using an excellent rapport. So these leaders, they excel. Mostly we can see they excel at conflict resolution. They're very good listeners, and sometimes we call them as a quiet leaders because they are leading by example. They are the perfect role model actually. So when we talk about this, they are specialized in working to change the system, solve the challenges innovatively. That is very important one. And also they are not going to use the old pattern. They are going to use something new. Also they are going with many changes. They are trying to go with a lot of changes. They are leading with the change, and they are also helping to maximize the team efforts, team capability, and team capacity is maximized. So when we talk about the leadership, this kind of leadership, transformation leadership in nursing, we know very well the healthcare organizations is very much continuing to evolve because we need to meet lot of demands, lot of challenges, and we need to render a high quality patient care. So we need to go with this kind of leadership style. That is very important. That is the need for opting this style. And also when we see today's healthcare leaders, they are facing lot of challenges of meeting the high expectations. High expectations. So we know very well this kind of leadership is very important to transform the teams to higher levels of practice. So here, leaders who are inspirational to the team and motivating them with a vision is very important. And same time, in nursing leadership development, these kind of leaderships, when you see, they are like stylistic. In the like these kind of leaderships are very important. Stylistic one, which is helping to lead the change, which is helping the quality improvement within the organization. And also they are going to be a mentor, and they are going to be a coach, and they are also going to coach others, and oftenly whenever it is required. That is very important. They are very open. They extend their open arms, and that is more important. So we all know very well there are many leadership styles which is followed in nursing, like autocratic, where the leader is having all the control, and bureaucratic is nothing but the leader has a control, but there is a defined
Hello.
rules and regulations, and the standard is followed. And also the
Hello.
servant style is where they are going for serving. And
Hello.
also like nursing, we are following a servant style
அவரோட
leadership.
லிங்க் வந்து
And
மீட்டிங்
also when
லிங்க்
we
வந்து
talk about
அவங்களுக்கு
the other
மண்டே தான்
leadership, there
கிடைக்குதா?
is participative, they can participate. The
அது
laissez
கொஞ்சம்
faire, laissez faire
அது
is they give the freedom.
இன்விடேஷன் ஃபோன்
But
நம்பரில்
when you talk about the transformational
அதனால்
leadership,
கொஞ்சம் பேசி
here
அதை
we are
வாங்கி
going to
கொடுக்க
mix
முடியுமான்னு
everything.
கேட்குறேன்.
We are taking all the good essence, which is
மிச்ச
very
டீட்டெயில்ஸ் அந்த
important, and
கெஸ்ட்
all the essences are
டெசிக்னேஷன்
together. It is being
ப்ராடக்ட்
put
நேம்
up
ப்ராடக்ட்
together as a
டெசிக்னேஷன்
bundle, and this is going to be rendered for effective care, effective
அது இல்லைன்னா
quality,
நம்ம
and it is also
கிரியேட்
very
பண்ணி
important
தட்டுமான்னு
for
கேட்டேன். இல்லை
effective
அப்படி பண்ண
productivity.
முடியாதாம்மா.
So the good leaders, they are boosting the
அவங்க
productivity,
வேற
they're
லிங்க்
increasing
யூஸ்
the
பண்ணலையா
satisfaction,
மண்டே தான்
and they
கிடைக்கும்.
are improving the performance. And also many organizations have achieved this success mainly by adopting this kind of
நான் அது
leadership
எங்கே
style,
செமினார் ஹாலில்
especially
எங்கே
by the nurse
மீட்டிங்
leaders.
போயிட்டு
And
அந்த
this model is very effective for the nurse leaders. So also this kind of leadership in nursing is very adaptive. So as I told, it's a quiet one. It's adaptive. It's going to be supportive because the environment will be supportive, and the shared responsibilities will be there, and they are going to influence the new ways of knowing and which will be created. As well as it is going to motivate the followers by appealing to getting a new ideas, generating new ideas, going for a moral values, and also using a integrity in practice, which is very important need. Integrity is more important because nowadays there are a lot of integrity issues. So where the leader has a deep set of internal values and ideas. Also, this leads to followers. Mainly, it is helping to sustain a greater good of organization, and it is very important. It's greater good because it is going to help in becoming a good leader and good for the organization and also for the people. And also, when you talk about this kind of leadership, it is very going to maintain a positive relationship, and motivation is very important crux. And also, it is helping the team as a whole. Nobody is going to be individualistic one here. And also, people are very enthusiastic, charismatic, and they are mainly focused on successful outcomes. They are getting that. And it is a very important, this kind of leadership style is a gold standard in nursing leadership, because it is promoting and it is improving the patient outcome and greater satisfaction among the staff nurses. So here, when we talk about this, the characteristics of the the transformational leadership in nursing is going to have a clear goal, clear vision, and it's also mainly helping in maintaining the integrity model and fairness. This justification is very important. As a high expectations also, because you need to reach high. You have to aim high. You have to reach high. Like when our honorable Dr. Abdul Kalam is telling, you have to dream big. So similarly, we have to dream big, dream high, aim high, and we have to go for a high expectations and encourage others and provide support and recognition. So whenever somebody is doing something without recognition, nobody will try to. Acknowledgement is very very important, and stir the people's emotions. And also, it's very important because it helps to get the people to look beyond the self interest, and it's very important to inspire the people. So why we need to go for the transformational leadership in nursing? Because we know very well, leaders, they are very direct, because they can approach
Sir, good
directly.
morning, sir.
Because very important is managing the human resources in nursing. We are managing that. So very important is we have to improve the employee performance, and very important also the career opportunity and the development should be fostered. And this is helping mainly in equality, care, and efficiency. Also, we know very well that as a professional, nursing professional can apply this kind of leadership in different fields, because they can be in health industry, it can be educational industry, it can be in the occupational setting, it can be in the school setting, the community setting, wherever we are going, wherever the scope is being broadened, we can use this.
In case of
So
sir,
this kind of leadership we call it a people person, because that is why the nursing role, it is very apt. It can be adapted very important in nursing role, because nurses are always people oriented field. So the people person, so they are going to be a good example. And also they are able to, this will help them to demand it will demand the
Monday
best
எடுத்துக்கிறேன்.
of themselves and others. They can come out with the best, and they will also know how to
சரி ஓகே
show
அப்போ
off
அவங்க
themselves.
பண்றாங்க சார் ஏன்னா
So
எவ்வளோ
by
ஒர்க் போட்டுருக்கு
example,
அவங்க
they can
ஒர்க்கில்
lead by
எடுத்துகிட்டு
example.
போகிறது
They can implement in the workplace
மண்டே
system,
வந்து
and also they can support. Especially this is helping to uh, helping the growth of the employee, employer, well-being, and morale of both. Also, it is helping in
ஓகே
relying. It is
வேறு
mainly
ஏதாச்சும்
aligning the
வேணும்னா
skills,
சந்தோஷ்
abilities, and
கிட்ட
interest.
பேசிக்கலாம் சார்
Also, the
பாருங்க
motivation of the employees. Especially,
ம்
it is going to be aligned with the ability, skills, and also the objectives of the team and the organization. So there is no
சரிங்க
mismatch.
சார் ஓகே
Everything is going to be aligned, and
தேங்க்ஸ்
that is going to give a best result. So focusing on applying these skills like empathy,
பார்க்
teamwork,
பிளேயரோட
flexibility, and
அருண்ராஜ்
creativity is
நம்பர்
very
சார்
important to inspire the
பார்க் பிளேயர்
employees
அருண்ராஜ்
mainly
தெரியுமா
to achieve the workplace goals. So when we
செஸ்
talk about this, it is helping to earn the respect also. The leaders, as I told, we have to manage the human resources, which is very important in nursing. Also, we have to foster the
வெற்றிக்காக நம்ம
development of each
செய்ய
other,
வச்சிருக்கோம்
and also the quality care is very very important.
வெற்றிக்கு
Productivity is
இருக்கு
important, and a
டிஸ்கனெக்ட்
person, nursing professional should be a people person. And also,
ஆகிடுச்சு
when we talk
ஆகிடுச்சு
about the nursing person, they should lead by example. They should help in the growth of the employee,
இது ரெடியாக
well-being,
இருக்கு
and morale.
பண்ணிடுச்சு
Also, they should be very
நேற்று
flexible,
கரெக்டாக வந்தேன்
empathetic, and teamwork is very much
அதெல்லாம் செட்
a
பண்ணுறது
focused
இது
one. And creativity is very important, and they need to inspire others. We have to bring out new innovations, and
ஆமாம்
also we have to build up the
20 ஆரம்பிச்சு
persons, like they have to come under the leadership. Everybody should be a leader, especially
இன்னைக்கு
charismatic
இது
leader,
நமக்கு பிரச்சனையாக
innovator, and
இருக்கு
very nurturing. And also those who are
அதர்
following this
ஆஃபீஸில்
is
ஓகே
very important, because under the
காலேஜில்
admiration they'll be admired by everybody. And also, when we talk about this, the particular leader is mainly followed, because he is being followed because the team feels them. They'll team will support them, they'll value them, and they respect them. So that is very important. They earn more respect because of this kind of leadership. So what are the techniques in transformation leadership? Very important is aligning the organization's identity, aligning with the interest of the organization is very important, and they should have a common goal and objectives, and also should have identify the opportunities mainly for the improvement and developing a vision which is matching. That should not mismatch, it has to align. Vision should align, and team members or the employee need to take the responsibilities, and giving the team members control over their jobs and duties. So we have to give them the freedom. I told you already, we have many styles of leadership. There is autocratic is there, bureaucratic is there, servant style is there, participative is there, and also we have other one that is which is going to be the laissez faire. So all this leadership, we are taking the crux, we are taking the essence, and that is mixed together to form a transformation leadership, mainly to transform. You are going to transform the person. Transform is mainly, this transformation is very important to gain the productivity. That is where we have to go with this. So what are the pros of the transformation leadership? When you talk about the pros and cons, everything will have a pros as well as cons. So when we see, the cons will be very less, but pros is more. That's why we are going for this. So it's very important because it is helping in motivation. It is helping to maintain the workplace integrity. It is going to have a clear vision and goal. It is going to encourage the professional development. It is very important mainly to improve the loyalty and also decrease the turnover. And it is very important because it is going to ease the transition, and it is improving the communication. Also, it is a very important one, is it is going to create a new ideas. It is going to generate new ideas, and those kind of ideas are communicated. That is very excellently, it is going to communicate. So other pros can be like, it is helping balancing, because it is going to completely balance the short term goals and the long term goals. Also, it is going to build a coalition or the collaboration, and is going to help a mutual trust. Everybody needs to be trustworthy. And it is very important, as it is going to have a emotional intelligence, which is very, very important, because no other leadership is going to have this emotional intelligence, the soft skills which could be used. It's then done in transformational leadership. So when we talk about this particular one, we know very well this cons. There are very few cons where, but those cons could be completely neutralized because the pros are more. Because sometimes these kind of leadership style is giving more importance to the long term goals over the short term. So we all know very well short term goals are very important, and it has to be completely achieved. But sometimes we are prioritizing more on the long term goals, and because of this, the short term goals are completely overlooked. And sometimes it is kind of transformation leadership. When you are going to try to go with the long term goals, sometimes it may increase the potential for burnout, stress. Sometimes it is also going for a continuous communication is very important. Sometimes when you are going to have a break in the communication, then it is very difficult. And also it is going to slow the decision making. The decision making process will be completely slowed down, because sometimes when you are going to completely involved in the communication, when you are going to completely involved in the innovation, the decision making sometimes will become slowed down. And also sometimes there may be ineffective, because in initial stage or in ad hoc situation, we may not use it may not be very much applicable, because initial stage it is not going, because it is going to go with a long term vision. It is going to have a visionary, so it may not be very effective. Sometimes it needs sometimes it may require a existing structure. So where the, because when you see, it should have an old organization, then only it can be applied. If you're going to start something new, some new organization, this may not be very much applicable, the growth cannot be seen. And sometimes it is not good fit for the organization, because there is a standard, established rules, established regulation. In that case, you may not be able, because this is flexible, so you cannot use this transformational leadership style. So that's what. So when we talk about the advantages, same like pros only. When you talk about the advantages, this is very important because it creates an atmosphere which is going to foster a higher job satisfaction. It is going to help in the increasing the morale. It is going to have a positive impact on the patient safety, patient outcome. It is very important for stimulating the creativity and encourage learning. It is helping to bring the motivation, and it is also helping to completely go with the enthusiasm to the enthusiasm. People are very enthusiastic in the workplace. They are liking to work. They are liking to participate. They are liking to do, perform. So that is where also it is giving a direction. So because there is a respect, they get a respect. They are earning the respect. They are valued by people. Also, they get continuously. They can innovate. They can go with a change. They can bring something new. They are novice. They are able to improve their morale, and also very important is they can mentor the employees. And the employees also can be transformed into a leaders. So that is very important, because you're going to a leader, a transformational leader is going to bring multiple transformational leaders. And it's also very important to drive the continuous improvement. And also it is very well liked, because the team members like this very much, because it is very innovative. It is not monotonous. It is going to be something new. And also people are going to get the freedom to do the best. So coming to the disadvantages, employees here, because I already told, they have a burnout. They are also overlooking. They are not able to take it properly. They'll overlook the reality sometimes. So sometimes some things are neglected. Here also sometimes there may be proper. So it is unidirectional. It has only one direction, and sometimes no multi-direction. So that is where the people cannot go with the multi-dimension. Already we told about the bureaucracy, and also this can be very hard for the people, because here as they give them the brief, people are taken as a team, no, we cannot fire the people, we cannot have them under the control. And sometimes there can be sometimes opposition, powerful opposition, because here the people employees are given the freedom. Yeah, everybody is given the freedom, the followers are given the freedom. So what happens sometimes, if they don't like, they'll oppose, because they have the decision making, they are able to express themselves, so they can oppose. They will not align, they will not align with the goals, they will not try to accept, and they will try to reject. So these are the things.
சரி
Sometimes there may
ஓகே.
be friction,
இப்போ
because
இப்போ
of this the friction can occur in the
கவனிங்க.
organization. And
இப்போ
also
வந்து
it's
அந்த
very
அப்ரூவல் டீம் வந்து
difficult,
குரூப்
because
கிரியேட் பண்ணியிருக்காங்க.
sometimes
ஆஹ்
it is very difficult to let the
சாரு
employees
ஒரு
go,
அப்ரூவல்
we
டீம்
cannot do
ஃபிக்ஸ்
them,
பண்ணியிருக்காரு.
because we have to,
கைலாசம்
sometimes
சார்
it's very difficult to keep them
உங்க
under the
ஆஃபீஸ்
control.
ஸ்டாஃபோட
So when you talk about the transformational leadership in the healthcare,
கேக்குதா?
they are very important, because it's a driver of improvements in the multiple areas and multiple dimensions. It is going to innovate, and it's helping to make a changes in the healthcare. This need is very important to continuously improve and remain competitive, because we know that particular nowadays that it's a tech world. We are in a techie world. We need to be techno savvy. So in this kind of tech world, transformational leadership is the apt style that could be used in the healthcare. So here, when we talk about the nursing leadership qualities and behaviors, when they follow this style, it is very important, because they can help the organization to adapt the technology. They can be the drivers. Nursing personnel can be the drivers for the patient treatment, for the patient outcome, for the better outcome. And also, this is very cost effective. You can reduce the cost if you're going to use this kind of leadership. And it's helping to innovate. It is helping to become more competitive, inspiring. People can inspire others, and they can be a team players. And also they can make the others to become a team players, making the others to become active members, to be a participants. And I mean, they can also be the leaders, and it can encourage the physicians and nurses to become more supportive for the change. So what are the other qualities, how a person can become a good transformational leader, nurse leader? Because you have to be likable, you have to accept, you have to very important is, it is easy to work with, they need to be inspirational, they should be integrity should be there with the personality, and they should be a problem solver, they should be a good teacher, they should be a good mentor. So I think the students are here now, they are looking into this. I think you can watch your teachers, you can watch your principal, you can watch your vice principal, you can watch your faculty team, they themselves are transformational leaders, you can see them. So whatever I'm telling, I think you can see the quality, because they are good mentors, they are good teachers, they are helping you to learn things, they are helping you to take up a vision, they're helping you to achieve a mission, they're helping you to achieve the goal. So these are very important. So also when you talk about this, communication is very
முன்னாடி
important quality that is required.
ஏபிஆர்
Conflict resolution, you need to completely go with the conflict proactively, especially proactively, in sense you have to listen properly, and you have to try to solve any issues that is going to occur with taking a proper decision, and proper problem solving technique should be applied, and should be very supportive, should be empathetic, not sympathetic. So we all know very well, as a nursing personnel, we all are empathetic. And positivity is very important. We have to spread the positiveness and fairness. We have to be justified. Nobody should be taken one person high and one person low. Everybody should be taken, treated equally, and they should be taken equally. And also, whatever we render them, whatever treatment is given, that should be a fair treatment. Whatever is being done to them should be a fair one. So that is very important. So when you talk about the leadership, why it is effective in nursing, especially, it has a very important positive impact, especially on the patients, on the employees, and also on the organization. It is creating a very good positive atmosphere, mainly for the continuous improvement. Also, very inclusively, it is going to improve. People are going to become inclusive. They are going to be, that is actually when you talk about the participant style, we are going to be included. So you are inclusive. You are having a visionary. They have a vision. And also, it's very important that is they are able to motivate others mainly to follow. That is where we can see this. So also when we talk about this, the effectiveness in nursing, mainly they have found there are a lot of researches being done. I'll tell you the researchers, a few researchers. In some researchers, they told it is going to cause low nurse turnover compared to other leadership styles. So transformation leadership style, only there is a 13 percentage nurse turnover, whereas in non-transformation leadership style, there is 29 percentage nurse turnover. So it is very important to reduce the nurse turnover. Same time, the patient safety and satisfaction. Many studies is being done. So they found this transformational leadership theory is very important nursing stylistic theory, because it is going to help give a positive impact, especially on the patient safety culture, especially in the patient participation, and also it is helping in the work engagement. So it is going to give a proper satisfaction. So also when we talk about the other one, it is nurse empowerment and job satisfaction. So when we have seen about the patients, now we can see the nurses themselves will go with the empowerment. and they'll go with the satisfaction. So there are many study notes, and these study notes are saying that the job satisfaction, it's with that, because the high job satisfaction is very important for the employees, because they'll feel very good, they'll feel very happy, they'll feel valued, they'll have a positive perceptions in the workplace, they'll try to be motivated, and they'll be intrinsically motivated. So that is where it is very important. So it is helping them to go with a positive perception, a positive outlook in the organization, and also it is helping them to lead to better, and also they become more passionate, more interest to work. So the self interest is also developing. And when we talk about, so when we talk about all this, so the empowerment is there, job satisfaction is there, patient participation, patient outcome. So all this is very very important, and especially the nurses turnover. So this is going to be a very good for the organization. The organization is, many organizations are seeking this kind of leadership only, and nurses are also choosing this leadership, because we know very well there are many leadership styles that has emerged now in the technological era, and especially in 21st century, transformational and transactional. What is transactional? Transactional also, it has its own vision, but transactional leadership style, when you see, it is mainly helping to have a extrinsic motivation. Only the motivation is coming from outside. Whereas when you talk about the transformational leadership, the motivation, we are trying to help the person to have their own motivation, self motivation, intrinsic motivation. There are many intrinsic factors. So the intrinsic factors are also stimulated and triggered mainly to achieve the goals. So here, when we see the transformation leadership benefits, how it is going to benefit. Already I told you, increase the safety of the patient, increase the outcome. It is going to help in the employee retention, because it is going to reduce the turnover. It is helping in getting the recognition. People will feel happy. They will not leave the place. They will be staying there only because they are getting their work is recognized. They are feel happy. They are feel acknowledged. They feel they are accepted by everybody, and it is going to instill joy. That is very important. Resilience, we all know very well. We have to talk about the resilience, because nowadays people don't have resilience. Whenever I go to the hospital side, I'll always ask the nurses, why don't you smile? Because I never see them smiling in the hospital side. And whenever we go for the supervision, we see the nurses all the time. All the time, even the physicians also will smile, but nurses will never smile, because all the time they are overloaded, and they are not able to manage the human resources. They are not able to manage the materials, manpower, and resources. That is where they are feeling that, as is very importantly, they're not able to balance the work and lifestyle life. Work and life balance is very difficult. They are not able to balance the personal life and professional life. So that's why they are becoming very tired, they are becoming very fatigued, they are having burnout, they have stress. So we have to improve the resilience, we have to make them to come back. So we know a rubber band, when you take a rubber band, the rubber band, when you pull, how much ever you pull, the tensile strength is more, it comes back to the originality. Similarly, the nurses should come back to the originality. So I think today, the nurses, the nursing students who are sitting here, tomorrow you are going to go to the healthcare industry, and you will become a good nurses. You will become effective nurses. And I wanted to see that you are going to be a transformational leader, where you are going to use resilience, you are going to be intrinsically and motivated, and you have to also go with the extrinsic motivation, and you should be a perfect leader. That is why we are talking about this to you all today. Okay, so you should not think why this kind of things is being taught to us, because this is very important leadership style that needs to be adopted by everybody. So when you talk about this, unlocking excellence is very important, because this kind of leadership is going to give a very good guide to the nursing practices. So when you are going to build this, what is very important, because compassion, when we talk about, see, that's what I wanted to tell you, very important. Tech era, when we talk about tech era, everything is being replaced by robo, because we know artificial intelligence has come, AI is developed, robots are developed, people are even replacing. Sometimes robots are assisting in surgeries, robots are serving the food, robots are doing the nursing care. But robots cannot replace nurses. Nurses are the boon. And this nursing profession, whatever we have taken, is a boon. It is a very important boon for us, because every profession could be replaced by robo, but nurses cannot be replaced, because nurses are having this particular component, compassion. Only compassion could be given. Only the heart, that is emotional. When we talk about the emotionality, when we talk about the emotional intelligence, the communication, interpersonal relation, rapport, compassion, whatever we are going to show, empathy, whatever we show, a robot cannot do it. Only a nurse, a living nurse can do that. A live nurse can do that. That is where this particular transformation leadership is going to be a beacon of influence and for the nursing profession and nursing practice. So here there are many core characteristics which are called as the building blocks of the transformation leadership. So like they have to together. So what are the characteristics? They are to work together to develop a feeling of team. They should be an example for everybody, and also they should have a innovation and continual improvement is important. Mentoring and nurturing the individuals, and they value the input, and whatever people team members are giving the input, that should be valued, it should be appreciated. And they have the ability to articulate a vision, and also they have to inspire others, especially the team should feel valued, and they have to welcome the input of everybody, and they should be motivating. No punishment, because I told about the transactional leadership. Transactional leadership, what is the difference? Because in transactional leadership, the motivation is there, but it which includes punishment and reward. That is where the motivation. But here, the motivation is done without punishment and without any reward. So here, the people are free. They are not harassed. And also setting high expectations are very important. So whenever you do that, you have to set with high expectations for both themselves as well as the team. So there are many significance. When you talk about the significance, already whatever I told only, but I'll just tell the crux. Because here it should be the initiative, responsibility should be embraced in the roles, and it also whatever they do, it should exceed the expectation. It should not go. It should go beyond the expectation. You have to go beyond the expectation. You have to go beyond the horizon. So that is very important. This approach is very important because it seeks to inverse the top-down approach. So where we can see the staffs are not where they are not going to take the instruction or directives. We are not going to give them any instruction. We are not going to teach them like anything. We are just allowing them to freely think and do by themselves. So it is very sustainable approach also, because it is helping them to identify the goals. They can set their own targets. They can execute the task, because they are not going to give any direction. They are not going to give nobody is going to give them any instruction. So here the nurse employers or administrators, they use this method because it's very competent. It is going to motivate others, and it is going to be helpful for the organization, especially as a team. So when you talk about this, it is also very setting, because it is involves the setting where you can be a good example, impeccable example for others, mainly to follow, and you will be a good person who will be led by everybody. Mahatma Gandhi, he was a very good charismatic leader, and many people follow Gandhism. They follow the Gandhism, whatever he says. And I would like to, in this juncture, I would like to tell, I'm in Africa, in Ethiopia. In Ethiopia, there is one beautiful street in Addis Ababa, the capital city. They have a very beautiful street, a big street, and named by Gandhi Street. I Mahatma Gandhi Street. I am very proud because as an Indian, if in other country, when we see our person, our leader Mahatma Gandhi, his name is being chiseled there, that is something which is a great achievement for us. So because he was a transformational leader, he was a charismatic leader. So here when we talk about the four pillars, what is very important, everybody we need to know how to lead, because the Bernard Bass, he is the one who has given this particular four pillars that is required for the leadership. Because when you are going to lead with confidence, we need to have this. First one is inspirational motivation, because you have to have a vision. You should be able to communicate with a sense of commitment and passion. That is very important. You need to inspire, especially to do the best. Second one, individual consideration, because a leader should take the time to know each team member. They should learn about the team members' strength, weakness, motivation. They have to dedicate themselves, because they should be a mentors and should be leaders, mainly for the change. Leaders to change, lead a change. Intellectual stimulation, because they are four eyes actually. So intellectual stimulation, it is a value. The ideas of the team member should be valued, because we should allow them to think out of the box, and also bring the very important topics, because whatever their inputs they give, it should be used for accomplishing the objective. So that is very important. We should welcome the creativity. We should welcome the ideas and input of the person. So we have to go for the intellectual stimulation. And last one is idealized influence. When you talk about the idealized influence, it is mainly we can see they are setting a good example, mainly for others to follow, and doing it in the same manner, mainly for the betterment. Okay, so other qualities is self awareness. They should have authenticity. They should be very authentic in their whatever they do, and also they should, because they should have a proof. They should have a proof. They should do it properly. They should have justification. Whatever they do should have a proof, and they should have something, a solid evidence. Also, they should be able to collaborate. They have to understand interdependence. Nobody should be higher. Nobody is high. Nobody is low. Everybody should be interdependent. And also humility is very important, because we have to accept each other.
130 sir.
Humility, where we are trying to accept the, we have to be
ಸರಿ
humane. We
130
should
ಸಾವಿರ
accept the
ಪಾಕಲ್ಲ
human. We
ನಾವು
have to be
ಅದಕ್ಕೆ
human.
ನಂಬರ್
We have to accept the nature of the human being. We should not shout, be aggressive. So that's what we have to talk about this. So when we talk about here, we have many traits, especially the very important is visionary. So whenever a person is going to be there, we know very well the person should be a visionary leader. That's what we have to see. They should have a very good attitude, and also they have to go with the proper risk taking, and they should be able to balance it. That is very important, and they should be more creative. So creativity and curiosity, inquisitiveness is very important. Then only they can learn. As well, especially they should be very simple. Already I told they are quiet leader, they are people's leader. So they are people's person. So they are simple. They are more simple, and they are very humble. They are visionaries. They are going to have a good attitude. They are going to have a very good. When we talk about this, they're going to be they are going to take the challenge. They are going to be a risk taker. They are very curious. They are very creative, and they are very inquisitive. So other key traits we see, because they are able to respect and go for an open collaboration. They are able to integrate. Integral aspect is very important. They can take action. They are going to build a supportive environment, mutual trust. People can believe them, and also exceed expectations on daily task. And also they don't set any targets. Today I should do this, tomorrow I should do this. Whatever they are able to, maximal output they give, maximal input they give. That is very important. So also they are going to visualize the improved system. They have a very good visionary, because they all are organizational oriented, and also they think resolve conflicts proactively. They're going for active listening and innovators. That is very important, and go for the effective communication, create a good inspiration, and they are very good model for a change. Whatever we want to see them, we can see a good change in them. And other also very important is they are allowing others also to become actively involved. They never only go with the focus, only their self focus. They are just trying to see how about others also. They're trying to pull others. So when we see others going down, we should try to pull them, and we have to pull each other. We have to help each other. We should give hands for each other. And also the challenging process, we have to accept any challenges, set high expectation, high goals, achieve the goals, and very important is demonstrate competence. So there are certain attributes. I already told why Mahatma Gandhi ji is brought as what, why we are talking as a transformative leader means because of this particular quality, charisma. So the attribute is charismatic. They should be more charismatic. They should be inspiring. They should be creative. They should have a moral values, ethical values. They should be very encouraging. They should encourage others also, self and others. Very open minded. They have to accept the inputs from others and acknowledge that. Visionary. They should all have a vision and mission, and they should be very importantly hardworking. Without that, that could not be done. So when we talk about the components, there should be a leadership by example. They should have a clear vision, clear objective. They should think creatively, and everybody should have be able to assess individual as individual assessment. As for example, I should assess myself. I should know what is my weakness, what is my strength. Also, I should be able to assess others. I should also know their strength and weakness. I should try to improve their strength and try to completely neutralize the weakness by improving oneself. That is very important. So here, when we talk about the characteristics, the three C is very important, like coordination, collaboration, communication. So these threes are very important, especially between the leader and follower. So the coordination, collaboration, communication between leader and followers are the very important crux of this transformation leadership in nursing. That is only which is helping to go with the inspiration and motivation, and it is also very significant because it is helping to completely achieve the aims, help to go with the intrinsic drive. Already I told you transactional. What is the difference between transactional leadership and transformational? It is more extrinsic, but this is very intrinsic. There's an intrinsic drive. It is helping to go with a very good relationship with others. So it is going to go with a mutual relationship. That is where we have to see here. So there are many other characteristics like inspirational motivation. It is very important where we have to motivate others, and self openness to new thinking. We have to be open minded, and also talent for broadening the minds. We have to completely bring out many ideas. Everybody should bring out the ideas. And also when we talk about this commitment, we have to listen to others. We have to commitment to active listening. That is very important because in this world we are not listening to people. That is where problem comes. When we are not able to listen to others, people are also not listening to us. So when we are nobody's listening to us and we are also not listening to others, we are going for mental issues, mental health issues. So those things, social issues. So and that can affect the physical health also. So these things are very important. And tolerance for intelligent risk. So whatever comes, whatever intellectual risk or challenges comes, we should be able to tolerate it. We should be able to find out the solution for that. And willingness to accept any responsibility, every multiple responsibility. You should be able to go with the responsibility with the same resilience, the same strength. no reduction in strength, not becoming weak. And also trust, very important. You have to trust everybody.
ఓకే
That is more
ఓకే
important.
ఓకే
So here,
ఓకే ఓకే
leadership identity, we have to unveil the
ఓ రెండు
traits.
క్వశ్చన్
So
ఆర్డర్
like
పెట్టిందా
individual
ఓకే
connection is
ఓకే
very important. You have to ask. So
ఎవరు
I'm asking
అడుగుతుంది
you,
ఎవరు
all the audience. Now I'm asking this question. You yourself check. This is the checklist for all of us. This checklist you have to see. Am I audible?
ஒரு ஒரு
Can you all listen to me? Am I audible? Hello?
ஒரே பத்திரம் தான் இருக்கா
Hello?
Yes, ma'am. You're
Okay.
audible.
Yeah. So
நான் மூவி
the
எடுத்துக்கிறேன்
so
அதான்
the audience, I please, I want you all to reflect. Kindly, you check. You put in a mental picture. You take this. I'm going to send the slide also to you all. You can also see the slides. Kindly check. Put a checklist and see whether you have achieved this. For example, individual connection. Do you take time to know each nurse on an individual level, especially students? You are able to understand each of your friends individual level. That is very important. Next one is teaching and empowering. Do you help your team members? Team learn rather than expecting them to know what to do. So you have to help them to learn. You have to help them others. And also, do you empower the team? You are able to give, take the, you have to provide an input, you have to provide a feedback, especially your feedback for your fellow students, for your fellow friends. Are you all doing it? Are you helping each other?
సెక్యూరిటీ
Continuous
పర్పస్
improvement. Are
వచ్చింది
you always looking for ways to improve the process? Your
సెక్యూరిటీ పర్పస్
institution and relationship with the team. Are you liked by your team? That is very important.
టెన్
Is
ఓ
your
క్లాక్
team loyal to you? That you have to check because you know very well. You have now itself. I know. I think the mute. I think you can mute yourself. So when you see relationship with the team, you can see the team, your friends, friendship circle. You all know how the friends will be formed. How the friends all cannot be friends. There may be group of friends. Two
సరే
persons can
అయితే
be friend. Three persons can be friend. Four persons can be friend. So there is a groupism. Why? Because
ఓకే
like-minded people only can attach with each other and they can stay together all the time. So it is not possible for you. See, sometimes we say train journey. When you go in a
ఓకే
train
ఓకే
or bus, you can see people, but you're just smiling at them. They talk to you for momentary, and when you get down, you
ఓకే
don't know who they are. But this is not like that. When you talk about the
ఓకే
relationship, you are going to stay with them, you're going to live with them, you're going to work with them. So what happens is you should know about them. You should know why you like them. You should know why you're all loyal to them. You should know the nature. That is very, very important.
ஓ அப்படிங்களா
Visionary
ஓகே
leadership.
ஓகே
Here you can know, can you articulate the concept
அது மேடம்
in
அப்புறம் அப்பார்ட்மெண்ட்ல
inspirational vision
கமர்ஷியல் ரன்
statement? So
பண்ணலாமா
I wanted to ask all the students, dear students here, do you know your organizational goal? Do you know the vision and mission of your organization? The Chair and College of Nursing organization, its
ఓకే
mission, its vision, what are the aims and objectives? Do you know that? You have to go through that. You have to go through that. You have to be, because your leaders, your teachers, your principal, your vice principal, the management, your teachers, all are struggling to achieve the aim, achieve the visionary. But what are you doing? Are you all knowing it? You also should align with it. So that is very important. And leading by example. Do you lead by example? Because sometimes there may be few students whom we show as an example for others. Because everybody should lead by example. Communication skills. Are you a good communicator? What about the
ఫైనల్స్ ఏదో
motivation
అమౌంట్
leadership? Are you able to
పైసలు
motivate? Because you should not punish anybody. You have to motivate. You have to give them the proper direction. Next one is when you talk about this one, other traits,
ఓకే
commitment to excellence. Do you strive for excellence? Are you helping? So you're accomplishing the excellence. For example, this time you're getting your grade. You're getting 80%. Next time you should try for 90%. You should not go back. You have to come, you have to improve yourself. So you're getting 60%.
అది
Next time
కడదాం
you have to get 70%. So even you have to help your friends to get this. You have to help them to achieve. That is very important. Similarly, innovation and creativity. Whether we have to think outside the box, think more. I think you all be in a research phases also. Try to go with a good research, innovative ideas. Try to come with a very good patterns.
அதுவும்
So
விக்கிற
that is
மாதிரியா
very
இல்ல
important where you are trying to do something for the
அது
society. So
அது எவ்வளவு
you also
அமௌண்ட்
encourage others to do the same. Coming to the importance for the nurses is helping in the professional growth, team spirit,
ఆయిల్
patient safety, patient care, morale is very improved. That is more important. Productivity. Without morale, you cannot increase your productivity. Job satisfaction is improved.
సరే ఓకే
Also, how to apply this in nursing?
సరే
We have to offer what are the actions. I'm talking about the actions.
ఓకే
Transformation leadership
ఓకే
action. What to do in nursing? First of all, we have to offer support and recognition, and also practice integrity. We have to practice the integrity, and that is more important, especially inspiring others. Is to mainly to most of the time we have to look beyond the self-interest. Only we should not focus ourselves. We have to see that what about the interest of others that should come. Inspiring motivation. We should not be self-focused, selfish, self-oriented, selfless. When I told about Mother Teresa, she has done a selfless services, servant style leadership. So that we have to assess. We have to accept. Inspiring motivation, celebrating whatever small wins. When you are winning, when your team is winning, your friends are winning, you have to celebrate it. That is very important. And also helping others find their voice. We have to help them to find their input. We have to help others to also give. Some people will be beyond, going behind. Pull them inside, pull them forward. Try to make them also to express. Try to make them also to have that leadership quality, and also attitude of servant leadership. I now only I told Mother Teresa. So we have to go with the servant leadership because we nursing people or servant leadership. We are trying to serve the people. So we have to go with the servant leadership style. So what are the five waves? That is very important to know if transformation leadership in nursing is right leadership. How you can understand. So first of all, we should know whether you're comfortable, whatever decisions you do, whether you're comfortable with the decision, whether you're able to, you love to inspire others, you wanted to inspire others, you wanted to be an inspirational model, you're comfortable taking a proactive approach, you're comfortable in taking a good approach. That is more important. Similarly, very important is you also should know, you know how to keep your ego in check. You don't have a problem, so there should not be any problem with the self management. That is very important. So those things are need to be taken. So this is very very important. So these 5 points you just check. I already told you a lot of things to be checked, whether you are passionate, your interest, and also you are able to help others, motivate others, and you are able to have a trustworthiness. All that when you see, you have to check this very importantly, whether this leadership is very important. You are comfortable with, when you take a decision, you are very creative, you're able to inspire others, motivate others, you are very proactive in approach, you are able to because you don't have any ego, you are going to keep your ego in check, you are trying to accept everybody, no egoistic behavior. And also you should never have any problem with the self management. You should be able to go with that. So these are the very important things. So coming to the conclusion, transformation leadership in nursing plays a significant role in promoting the positive collaborative work environment through guidance, mentorship, and motivation. This kind of leadership style is very important, which can inspire the teams mainly to feel them valued and respected. So that is where, see, whenever we do human beings, we wanted that value, we want the respect. So this kind of transformation leadership is helping the person to get the self-respect, which makes them to become more motivated, more motivated, and also more productive. So this increases the empowerment and leads for nurses retention, employees retention, and also helping in the patient satisfaction outcome in the industry. So it is a very much talk. We can talk more about this. It is the most talked about leadership style in the 21st century, and due to this, because there is a lot of technological changes that is occurring right now. So because of this, we know this kind of leadership approach is very important, especially to be used in this kind of world, which is more corporate, tech world, tech corporate world. We can use this transformation leadership one, which is the best leadership style, which takes the essence of everything. So these are my references. Thank you so much.